Teaching Left-Handed, Medical Student and Resident Guide to Basic Surgical Technique. "10% of the population is left-handed. However, residencies in medical schools rarely adapt to accommodate the left-handed learners when it comes to instrument use. Furthermore, it has been suspected that specialty selection may be up to 75% surgical in right-handed medical students, whereas due to limitations on instrument use, only up to 50% of the left-handed students consider surgical specialties. This educational video will address the following: managing right-handed scissors, managing right-handed needle holders, suturing and instrument tying, manual knot tying whether single or two-handed, and laparoscopic instrument use. In these videos, we will need to focus on the thumb, index, and ring positions and motion. These are referred to as finger adaptations. Note how the thumb and ring finger are within the scissor holes and the index is supporting the scissor handle or shaft away from the pivot point of the scissors. Note that when the scissors are to be used to effectively cut a suture or tissue, two motions need to happen simultaneously. The first motion is opening of the scissors. This is where the thumb and the ring finger are pushing the opposite handles away from one another. The second motion happens simultaneously in a different plane and is that of pressure being generated against the top handle, pulling it towards the thenar eminence, whereas the lower handle is being pushed away from the hand by the pressure generated by the group of fingers pushing against the shaft of the lower handle. When closing a scissors, instead of the motion with the handles moving away from one another, they should move towards one another. However, the second motion, where the handles are pulling in different planes, needs to stay the same, with traction towards the thenar eminence for the upper handle, whereas the lower handle is being pushed away from the hand. Use of a needle holder is the same as scissors, except that one has to learn how to manage the lock. Remember that if this is a right-handed instrument, then the pressure points applied just as a scissors, with slightly additional effort to release the lock. This is done again by pushing the thumb towards the thenar eminence, while the middle ring-pinky combination pushes in the opposite direction. Next, we will demonstrate the traditional grip and palming of a needle holder with the variations between the right and left hand grips. Note that with the right hand, the thumb pushes away from the thenar eminence, whereas the middle ring-pinky combination pushes towards the thenar eminence. This, as you recall, would be the total opposite of when using a right-handed instrument in the left hand. While holding a right-handed instrument, unlocking the needle holder involves pulling with the thumb towards the thenar eminence, whereas the other side pulls away. To lock, reverse the motion while pushing the thenar eminence itself against the scissors finger hole of the thumb, while the combination middle, ring, and pinky fingers pull towards the thenar eminence. This will rapidly lock the instrument. Remember to release, pull the thumb towards the thenar eminence, while pushing the combination middle, ring, and pinky finger in the opposite direction. If holding the needle holder with the left hand, a left-handed person may initiate the suturing from the left-hand side to the right-hand side while grasping the pickups with the right hand. Instrument tying involves rotating the needle holder held in the left hand around the suture that is held with the right hand and then reaching towards the tail that is on the person's left side of the field. The tail may alternate to the other side with every other tie as the sutures are placed. Remember to take advantage of wrist motion as the suture is being threaded and when attempting to reload the needle holder. Recall the two types of motion involving the different planes while managing a needle holder. Tie a knot using a two-handed technique. Cross the sutures and hold the threads with the index and thumb in each hand, while maintaining the left-handed thread above the level of the right-handed thread. Approximate the left hand's thumb and index while trying to grip the right thread in between the two tips of the finger. Then, use the left index to push it through the loop and under so as to create a robust tie that can be cinched down thereafter. Push with the index finger to ensure that it is cinched down adequately. Then, using the left thumb, take the left thread and deliver it around the outside of the thumb while the thread is attached underneath. Move the right thread across the thumb and deliver the left index into the loop. While the index is in the loop, attempt to grasp the right thread with the index and thumb of the left hand. Then, push the thread through the loop using the left thumb. Pull the threads and cinch the knot. One-handed technique. Remember that for any tie to work, the threads need to loop around one another. While pulling the right thread taut, loop the left thread around the left index finger and move that finger down past the tight right hand thread and attempt to push the index against the left thread, once again looping it. Once successful, pull the index upwards and the lower portion of the left side thread will pull along, creating a tie around the right-handed thread. To do the second part of the one-handed tie, hold the left thread with the index and thumb. Then, flip your pinky, ring, and middle fingers above the left thread as if in a chopping motion. This will position the main or long part of the thread under the three fingers, while the index and thumb still hold a small portion above. Then, place the right-handed thread on top of the three fingers close to the other small thread. Now is the tricky part. The middle finger will need to close around the right-handed thread and slide under the left-handed small portion, which is held by the left index and thumb. While pushing on the left thread, the middle finger will create the loop necessary to make the tie. Then cinch it down. Regarding laparoscopic instruments, these are typically universal, and most are usable interchangeably with either hand. Thus, no particular adjustments are needed based on dexterity. Particular port location or choice of instrument may be adjusted on the surgical field based on the surgeon's preference. To help maximize benefits from the learning experience, it may be wiser to identify learners early in training, attempt to pair them with left-handed mentors, encourage development of abilities whether right or left-handed, and if at all possible, to have left-handed instruments available.